In this video, we're going to debunk the 5 most common knee pain myths. Hi, my name is Stuart, and today we're going to talk about knee pain. A lot of people think they know what's causing their knee pain, but a lot of the times they're unfortunately wrong. So we're going to dispel some common myths about knee pain and show you how to improve it for good. So stay tuned. It's easy to see why some people might be persuaded by outdated knee beliefs, which might have become established before understanding of the problem evolved. Many of these myths make you feel like someone needs to fix the problem, but in many cases, with a better understanding, you can actually improve your knee pain yourself, and saving you time and money. Myth 1 is that running can increase the risk of developing knee pain. Knee pain is a common complaint among runners, and many people assume that running is to blame. However, recent research has shown that running does not necessarily increase the risk of developing knee pain or knee arthritis. In fact, recreational runners have lower rates of osteoarthritis than sedentary individuals who don't move. The only group of people who have an increased risk of developing knee osteoarthritis are elite runners and professional athletes that are clocking a huge amount of miles each week. This tells us that it is not running that increases the risk of knee pain or osteoarthritis, but not doing any activity or doing an excessive amounts of activity. For most people, recreational running is a low impact activity that can actually help prevent knee pain and knee osteoarthritis. Myth 2 is that you should protect the knee until it stops hurting to prevent making it worse. Many people with knee problems believe they need to rest their knee so it has time to heal itself, but the exact opposite is true. During the first 3 days since the onset of your pain, you may want to take it easy in case there is some soft tissue inflammation. Beyond this, however, it's important that you gradually expose your knee to more stress so that you can help improve your movement and with it, improve your painful symptoms. We'll go into this in more detail later, but in summary, you need to keep your knee moving to keep it improving. Myth 3 is that a steroid injection will fix my knee. Knee pain is a common problem that can be caused by a variety of factors, from overuse to arthritis. And while there are many potential treatments, steroid injections are often used to provide short-term relief. However, it's important to remember this is only a temporary solution, and repeated injections can lead to side effects, such as tissue damage. For people with chronic pain or those that are seeking a long-term solution, other options, such as graded movement, is much more effective. However, for those with an acute flare-up, a steroid injection can provide welcome relief. Just be sure to talk to your doctor first so you understand the risks and benefits. Myth 4 is that your knee hurts because you're getting old and it's a sign of arthritis from wear and tear. It's no secret that as we age, our bodies begin to break down. We start to get aches and pains in places we never used to have them, and things that used to be easy become more and more difficult. But just because we're feeling pain doesn't necessarily mean there's something wrong. In fact, research reveals that a surprising number of people experience pain-free knee degeneration. On average, 20% of people with pain-free knees have meniscal tears, and 19% of those over the age of 40 have meniscal tears but experience zero pain. 50% of those over 40 have asymptomatic, so next time you're feeling a little ache or pain, don't automatically assume it's because you're aging. Myth 5 is that you shouldn't take pain medication because it will mask the pain. Some people may be hesitant to take painkillers because they believe that by doing so, they'll mask the pain and end up causing more harm than good. Or you could feel compelled to avoid taking medicines for personal reasons, and it's easy to see why you might think this. Short-term pain relief medications can help you get back to activity and recover faster if you take them according to your doctor's or pharmacist's instructions. This is because acute knee discomfort is typically the result of increased sensitivity in the knee rather than any damage. It's vital to keep in mind that pain is not always proportional to damage. Gradually increasing your knee movement through discomfort with the assistance of anti-inflammatories, after the first 3 days that is, can help to break the vicious cycle of pain, decreased movement, tightness and sensitivity.